Hey everyone, I'm Dr. Simpson, founder of Top MD LLC, where we turn USMLE prep into clinical mastery. Today we're tackling a top step 1 and step 2 favorite, serotonin syndrome versus neuroleptic malignant syndrome, NMS. Let's break down their key differences and high yield clues you must know for test day. Let's get into it. First off is pathophysiology serotonin syndrome, caused by excess serotonin, usually from SSRIs, MAOIs, SNRIs, TCAs, or serotonergic drug combos, like SSRI plus linezolid or fentanyl. Overstimulation of 5-HT1A and 5-HT2A receptors, especially in the CNS. Neuroleptic malignant syndrome, NMS, due to dopamine blockade, most often from antipsychotics, especially first-gen like haloperidol. Can also occur from sudden dopamine withdrawal in Parkinson's patients. Next is clinical features and buzzword serotonin syndrome, rapid onset, within hours of med change, triad, autonomic hyperactivity, hyperthermia, hypertension, neuromuscular hyperactivity, clonus, tremor, hyperreflexia, and altered mental status. Buzzword, clonus and hyperreflexia, especially in lower limbs. NMS, slower onset, days after antipsychotic initiation. Triad, hyperthermia, lead pipe rigidity, and altered mental status. Buzzword, elevated CPK and myoglobinuria, rhabdomyolysis. Next is risk factors, serotonin syndrome, multiple serotonergic meds, drug interactions, e.g. SSRI plus MAOI, illicit drugs, MDMA, LSD, cocaine, NMS, high-potency antipsychotics, rapid dose escalation, Parkinson's patients stopping levodopa. Diagnosis serotonin syndrome, clinical diagnosis, Hunter criteria is key, spontaneous clonus, inducible clonus, plus agitation, etc. No specific lab, but check for elevated WBC, CPK. NMS, clinical plus labs, very high CPK, leukocytosis, metabolic acidosis. History of antipsychotic use is your clue. Lastly is treatment serotonin syndrome, stop offending agents, benzos for agitation, cooling measures, IV fluids, severe cases, cyperheptadine, serotonin antagonist. NMS, stop antipsychotics immediately, supportive care, cooling, IV fluids, dantrolene, muscle relaxant, and or bromocriptine, dopamine agonist. That's your fast and focused review of serotonin syndrome versus NMS, classic USMLE material. Clonus, serotonin, rigidity, NMS. Like, share, and subscribe to Top MD LLC for more high-yield board content and clinical wisdom. Hit that bell so you don't miss the next breakdown. Keep crushing your prep. See you next time.